Yep.
All right, let's call the meeting to order. Stand for the pledge.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Due to the current federal and state emergency declarations, Minnesota directed to residents to stay at home and guidance about limiting person-to-person contact through the COVID-19 coronavirus pandemic. This meeting of the Lisle School Board is being conducted in accordance with Minnesota statutes 13D-.021, meetings by telephone or other electronic means. Due to the health pandemic, the school board determined that it is not feasible for the public to attend this meeting at the regular meeting location due to the health pandemic. Persons may monitor the meeting from a remote location by Zoom. Information on joining the meeting can be found on the school website. Public comments prior to the meeting can be made by contacting the superintendent or the board chair by email. This meeting is being recorded. Access to the recording will be available on the school district's website as soon as is reasonably possible. Approval of the agenda. Is there a motion to approve the agenda? All those in favor? Aye. Aye. Opposed? Item 4, items for action discussion. Discuss and approve the option of distance learning from December 7th through January 15th.
All right, well, good evening, everyone. So thank you very much for coming in tonight on short notice. Last Wednesday, Bradley and I had spoken about our options. And then I talked to Carrie as well. I had a lot of anxiety and concern over the decision just because the recommendation from our school nurse, from Moore County Health, everybody, they were saying that we should continue distance learning through January 15th. The hard part about that decision is that impacts the staff and their livelihood as well. So, so tonight, the discussion I would like to have with you guys is, do we want to make a decision to continue through January 15th? And then on top of that, options for our support staff through this time. So looked up some information today regarding the decision as far as going through January 15th. Right now, our number as of this morning was in Moore County was 171 cases per 10,000. Our school district was 214. Both those numbers lie about right in the middle of the state. In contrast, Southland was at 212, Austin was 216, Glenville Emmons 212, and so on. So based on the information that I have, it is still my recommendation to go through January 15th. That's a tough one to make because I know most of the staff, especially during December, it's a fun month to have the kids in the building. But that decision, like I said, impacts our support staff. Bradley and I spoke this morning with Greg Gardner, who's the union rep for MSCA. There's a couple of options on the table. I feel a little bit better about them. So Bradley, if I misquote anything, just to let me know. But they kind of came down to a couple of options. On one hand, we could furlough any of those people that and reduce their hours for the next 5 weeks, and we will return on this January 15th or January 18th. The concern with that is that impacts their livelihood, that impacts their bills and the holidays, but it also, we run the risk of any of them possibly finding a job elsewhere, such as a bus driver finding a job for another company, and then we have to continue distance learning because we don't have enough drivers in January. The other side of that spectrum is we guarantee or we pay them throughout this whole process. I don't think any of us would agree that that is a good option, especially for the long run. The other option that the three of us talked about this morning was giving them the option to reduce their hours, but they could also make some of it up within the building doing other duties. We have come up with duties such as painting in the gym. We could, if there's some organization that needs with some equipment that's at the elevator, that have been confirmed that we have chairs and stuff there that we could bring over and organize which ones are good. Some of these are very short tasks, but at least it gives the option for them to come in. There's other options in the building. So I don't think any of us want to see any of our staff lose out on any pay. We certainly would love to bring the students back as soon as possible, but I don't think that's a wise decision at this point. But I wanted your input from you guys and to see where we should go next. Is there anything else I should add to that, Bradley?
You covered it pretty well, Jamie.
Jamie, like, do you have a number of how many people we're talking about?
Staff wise?
Yeah.
Well, that's a good question. So the unit out of the group that is not going to be affected much is the parents, because they're either on Zoom calls with students or they are working in Cubs Club. So they are good to go. It's the other ones. There's the kitchen staff. In conjunction with the drivers are delivering about, Heather, I don't know if you have an update, but it was as of last Friday, it was about 40. I think that fluctuates sometimes around 50 meals.
I think we're 60.
Excellent.
My last day.
And we may need to go to 2 routes, 2 drivers at that point. So, but still, that's a lot from the kitchen staff point. We went from making 300 meals for approximately 300 kids in the building several months ago to now about maybe 90 with the people that are being picked up. And then the custodial staff, that without the students in the building, that is a reduction in work for them. As the drivers, we have 8 drivers in total. 2 of them are continuing to work within their SMAC routes, taking kids to the ALC building, but the rest of them are all impacted. So it's a significant amount. One of the options that Greg, I didn't mention, is that it could be kind of a voluntary furlough. It's like I can use my sick time or my personal time, step back and not be expected to work. They don't lose their seniority. They just stay home and let someone else fill in their position as well. That is another option. So essentially the request is that we work it out with each individual employee based on seniority, and we go from there. Is that a clear way of explaining it?
Yeah.
Okay.
It really is unique to each position. You know, for our food service staff, they are still making some meals. So it's not like there's absolutely no food service to be done, but there's a lot less than there would be if all the kids are here. Obviously, we're not running bus routes, so there's a lot less driving to do. So
Have a bucket list of things to do around the building.
The short list, like I said, for some reason the painting always comes to mind for me. You know, in theory, we could have all the hallways painted. You and I know how difficult that is. We did down
That is
there.
very time consuming.
It is time consuming.
Everyone would get their hours.
Yes. So we could give the place a facelift. Now there is obviously additional cost to buying the paint and stuff like that, but unfortunately painting is the one area. This building is 8 years old now, 11, 12, 13.
13,
So,
14. Yeah.
Have any sort of idea from the prep discussions, what our people are kind of leaning towards? They have,
no, this kind of happened so quick that not really, but I just haven't had a chance to talk with them.
I would think that there'll be a variety of decisions made by different people as we lay out the options.
Kind of opened it up for decisions in a lot of ways.
If a person is furloughed, how does that work for unemployment?
They'd be eligible for unemployment at that point. And the ability to get on unemployment is actually fairly lax right now, you know. The,
Pick COVID.
Yeah.
And it lets you go through.
you know, realistically, it's not like they're gonna give somebody full benefits when they're still working. But there are people that have not had any change in their jobs that have applied for unemployment and got one. So, I don't know exactly how to explain that, but lots of people have applied, so. Yeah, if one of our staff that is still working applies for unemployment, I'm gonna click the button that says, hey, this person's still here and they're still working. But we also have staff that work other places too, and their hours could change, so. For folks that have multiple jobs, it's definitely a balancing act for the state. Try to take care of them on the jobs that they maybe lost some hours. And ultimately, it ends up that part of those costs come back on us. Anyway, they do it based on percentage of wages. So if we had 50-50 with somebody, we're gonna pay for half the unemployment.
Do we have any idea of what our neighboring districts are doing in the same situation with their staff?
You know, he asked Greg this morning, but he's more across the state. Most of them have been finding other work for them, the employees to do.
What if your other districts that you take care of? They do anything to-
So I haven't gotten to this point yet for any of my others yet. Most of my other ones right now are actually education districts. So they're very special ed focused. So it's teachers and paras for the most part. And the paras are staying,
Busy.
yeah.
Yeah.
And then,
Okay, I just,
yeah, that's a fair question.
I didn't know who you took care of. So
Yeah.
I would guess most districts are gonna try to find something for them to do, but
Yeah.
if they had, or if they had 6 months, you had 6 months of cleaning. Instead of 3 months.
Right.
So I would guess your list got shortened by the extra 3 months.
Because this hopefully will be back in, you know, January.
Yeah, and
So
because
not
we're,
looking at a, you know, really
And-
expensive-
there's not a lot of work outside that can be done
Right.
either, so.
Are there any internal maintenance projects? Minor construction? With the shop kind of.
I would think everything's on the,
Right,
I don't-
yeah.
Yeah, I don't-
But they were just so focused on cleaning, they didn't know if there's other.
I think you throw that out and say, hey,
I would say anything's on the table right now.
yeah.
Yeah,
And if we
We
can
want to
give them an
move
opportunity to work.
bookshelves, now's the time to do it,
that's right.
Yeah.
you know. Or, you know, I don't know how well the kindergarten room or the preschool room gets done because of all that. Maybe this is the time we empty her out and I don't, you know, I don't know what got done this, if that room got done. I know that's all we.
It'll be, I've walked the building and try to find some stuff, but
Right.
and all it takes is someone else coming with a different lens and like, oh, look at this, look at this. So
Right.
the list got long. It was probably 20 items in the spring. That was, you know, the painting was the one that did not get touched. That's why I'm drawn to it. But there are minor things across the building, but
And I'm sure again, each staff member is gonna have some things that
I think
they've been kind of putting on the back burner
I
too.
think you
because they just
go
haven't
to all
had
the
time.
staff and say,
Yeah.
hey, I've been wanting this shelf put in.
Yeah.
I know a shelf is all I can think of right now, but, you know, there's gotta be, you know, stuff that they do. Now's the time.
and I'd be even fine if they were, you know, willing to, you know, reach out to certain kids that to make a connection with them. I mean, even that's the most important reason we're here. So there's ways that we could even do that. You know, read with the kids, different things like that that I'm open to. It's just the option that the unfortunate part for them is if they don't want to do those, they may have reduction in hours. And, you know, he suggested, I asked the question, like, have it fill out a form and say, are you willing to work extra hours? If not, no, then they would, you know, they wouldn't get penalized for it. They're not going to get disciplined for it. They're not going to lose their seniority. They just aren't going to get the hours. They could use their sick time. I'm open to that if that's what you know, I don't know if they need to approve that or not, but, you know, sick time or personal time, I think this is an opportunity for them to, I don't know if that's a contractual issue. We didn't
Actually, the contract has language that allows for that in a emergency closing situation. So we're actually right in the heart of the contract language to allow for folks to flex whatever leave they've got in order to keep their day going. So
We would rather give hours than appointment.
oh yeah, that's yeah. I mean, we if we can do it, we want to keep our employees here and working and being able to feel like they can contribute positively to the school environment. So you know, it's no fun to not be able to do your job. So if you can do something that's close, that's better. If you can do something that, you know, you're working with your peers to do something good, that's great too. So
Well, and obviously over the holiday season, we don't want them to struggle. We want them to be able to make it through. We want them to come back in January and get rolling. So.
Yeah.
Want them to come back.
I do have a question, something positive here. Let's say right before Christmas, the numbers seem to get better. Are we gonna go to 15 no matter what? Or are we open to coming back sooner or?
And that's another thing I've debated. The initial thing was right through, you know, to come back on the 4th. That was the initial thought, but, you know, I guess time will tell. These next 2 weeks will be important because that'll tell, we know families were on the move this past weekend with Thanksgiving. So if the numbers seem to go down because of it, that's a telling sign that maybe we could come back.
Well, they say Christmas is doing it the same way.
And I think that period is even longer. So families, when they're leaving, they're probably leaving for longer.
Well, not all of us get 2 weeks for Christmas.
I know.
I mean, I know it's
But I
gonna be
mean,
a long.
if people are making a choice,
Yeah.
probably when they're gonna gather at Christmas time.
Right.
I mean, they might have given up on
Yep.
Thanksgiving a little bit, but
I agree.
they're gonna gather.
I guess I would like to see them. It's more about the elementary because I'm sorry that high school's been business so the whole time.
Are you saying you maybe don't want us to commit to that
Right.
far out?
Yes,
Because, I mean,
I want the option of coming back earlier. I get why we're doing it and all that, but
Jamie, do you?
that's a long time.
Okay.
And I realize, and maybe all the other schools, I know Austin's going to the board, or as last time I saw. And, you know, as much as things, we probably need to look what Austin is doing. Some of our kids come from Austin. But, and I understand the number is really high right now. I get that. I understand. But if there's a way to get them back sooner, I would be okay with that. But I understand why there's just things with the high school. I don't know how that's all going to work.
So I know Pacelli
Yeah.
they're come back the 11th, I believe. The other thing that,
Well, we've got them in the building right now.
right, for this
Yeah,
week, and
for
then we
this
go.
week and 2 days.
Um,
And then they're going to be out to the 11th.
Yeah. The other thing is we saw an influx when the numbers started to rise. We saw an influx of parents requesting to go distance learning. And Corey spoke with each of the parents and talked to them. Said, chance that we will be going distance learning, so let's keep you where you're at. So if we come back too early, we run the risk of parents saying, I want to go distance, I'm going to stay. And that's going to throw our schedule off a lot. So I agree with you. I'd like to bring them back as soon as possible. It's just that's that balance. So,
I understand.
of course, I don't know the answer to that. So
Jamie, are you feel?
Can I just ask, so
Yeah.
you guys, you work at Chili, so
Yeah.
you were in and then you went out, I mean, how did that work?
Well, we have several people that
Did
are
it come back?
keeping their kids at home. Yeah, just because of the concern.
Because they know they're gonna go within another 10
Yeah.
minutes, whatever.
Because they know
Why?
there was a lot of gathering over Thanksgiving.
Right.
My question is, if we keep them out for, let's say, 2 weeks, and numbers look reasonable, and we bring them back the week before Christmas vacation, how much learning is going to happen in that week when they haven't?
I think we should, this is
Just
what,
so they're fresh.
I agree. This is what I think, we should stay out until the first of the year. I just think we should. But it's another 2 weeks of not in front, I mean,
But that's the incubation period.
I know.
Yeah.
I know.
and that's the only reason that we're really considering.
Are you feeling, Jamie, like feedback that you've gotten from some of the families, like, are they feeling like they want, for planning purposes, to have a set date, even if it is 2 weeks into January, like wanting just to know that date instead of kind of little increments of, well, maybe we'll bring it back in 2 weeks, or maybe we'll bring it back in 2 weeks.
That is,
I don't like that. I would rather not do that. I just,
Corey, you want to give input on that one?
Yeah, I actually had my finger on the.
Oh, can't hear you.
I'm unmuted.
We're still learning the system.
Yeah. So a lot of the parents that I've spoke to, you're not ready.
All right, there you go, Corey, start.
Jeepers. Figure it out on that end. A lot of the parents that I spoke to, a lot of the reasoning for wanting to go distance learning was because the numbers were so high. And it freaked them out. And they said, you know what, we're just going to pull anyway, because the numbers are too high. We don't want to come back until the numbers are lower. That's what they said. And then as far as the bouncing around, so my take on this is I keep going back to the survey that was done before school started, and it was a reflection of the spring distance learning. Do you remember that survey? And the number one thing they wanted was communication and consistency. So if we're bouncing back and forth between in-person and distance learning, we're just doing what they're not wanting. But then the other thing is that if we're saying, originally we had said we would like to come back on December 7th. Now, I think all of us are starting to realize that's just not realistic. Like, that's not safe. A lot of districts are starting to see that as well. So they're pushing it back to January. And I know the frustration is not knowing which date in January to come back, but there's also a frustration for people who have young children in not being able to plan for that, because you have to have daycare, you have to make arrangements. People are having other family members watch their kids, but it's not just our parents with our children, it's our teachers with small children who are having to make these arrangements. So I think having the overarching response we heard from staff was, we just want a date. Like we just want something, and we don't want to keep bouncing around back and forth. So I don't know if I answered it.
No, it was good. Thank you.
I guess my is like the week of Christmas, if things, we have to decide if it's because we want to see it the 2 week thing after Christmas where we're at.
Right.
I was just saying, if it's before Christmas and the numbers look better, then we could just say, hey, should we? But just leave it at the 15th, but there's a possibility we might come back right after.
Well, our board meeting is on the 16th,
But
our board meeting. So we could say, I could send out a notice that says we are going to be through December. And then ultimately we can make that decision at the board meeting too.
Can I ask a question specifically for Krista? What are you hearing in the medical field in regards to the holidays and the numbers? I haven't heard, that's why I'm asking.
Usually everything's just blowing up. That's, I mean, they're looking at now starting to provide remdesivir outpatient because they're out of beds and out of staff. More so, it's they're out of staff to take care of patients
Mhm.
and fully aware that people are not staying socially distanced because they're tired of it and they're like, this is my family. I trust you, I know you, so I'm still going to gather. And sure enough, they come back positive. I have a coworker that just did that. Well, we went out to supper at a restaurant with the brother-in-law, or brother-in-law and sister. He turned up positive. They found out a week later that he had spent a week in the hospital, and she came to work and she was positive the days that she came to work, but didn't know. And then she got tested and now she's out. It's because we think that we know somebody and we just trust it. It's family, and
Mhm.
I think those things are going to happen. In general, the community is saying mask and stay distant and wait it out because there is the incubation period.
If we come
I'm
back,
sorry.
if we stay,
No, it's not the.
if we stay out to the 15th, in one way, we'll never know if it really made a big impact or not. If we come back on the 4th, and all of a sudden I may have to be maybe forced by the 6th to make another decision. So that,
And it is easier.
And don't sleep on New Year's Eve as another potential gathering
Yeah.
point.
that might be worse.
You know, that's another reason why I think the date that we're looking
I
at
don't know, I
is
go to bed by 10, I'm
a
busy.
good one. Yeah,
I'm too old to go out anymore.
me too. But lots of other people aren't that way right
And
now,
then they go
so.
home to mom and dad's.
I guess my big fear too, just looking at gatherings, is I'm actually a little bit more concerned about New Year's for the sole fact that people are looking at it as I'm leaving 2020 behind. So there's,
It's kind of best. to-
I know, I don't think if you have.
Well, I know. Just-
Overall, I applaud everyone that's been in this building and how safe everyone has tried to make this whole environment.
I mean,
They've done a spectacular job.
for the most
The
part,
staff has done a wonderful job.
yes, we've done a good job. We didn't have a blowout of cases. You know, so I mean, that's,
But they didn't come necessarily from sitting in class.
no,
You know,
no,
and that's
no,
the thing.
Right,
right.
That's the thing that
And
we
they
need to
didn't.
apply.
they didn't
It's
come.
community spread,
Yeah.
but we just don't want to continue the potential to end up coming to these schools.
The
Exactly.
measures that have been done in this building
Yeah, very good,
have,
Wonderful.
yeah,
very good.
yeah.
Very proud of everybody.
The staff has done, and I don't think, I wish Barb was.
And Barb.
Barb, yeah,
Barb's
Barb has been
amazing.
amazing.
Freaking amazing.
Yes.
And I don't think Corey, correct me if I'm wrong, I don't think I don't think there was any transfer of anything in the building. The people that were, because they were in close contact, we had to send them home, but.
you are correct.
And frankly, the parents have been very respectful of that. They have not argued, well, there's been a few that have argued, and been upset. Not gonna go into details, but they have, for the most part, they've been respectful. If the kids are sick at home, they keep them at home, so. It's just we're all feeling the yuck right now with this whole thing, and we're hitting that second surge that they predicted months back, and the holidays and everything else on top of that, it's.
Like for an example, I know at St. Mary's in Rochester, they have 6 dedicated units now, just for COVID pending. They've taken a PACU and made it an ICU. So that way they can take the trauma ICU and make it solely a COVID ICU. That's just, and staff droplet flights and not from spread within the hospital. The community spread, right? Sounds like we'll go with 15.
Yeah.
Offer a voluntary furlough if they want to
Yeah,
know,
if they want,
utilize if they want to, nothing forced, nothing,
right,
but if they wanna just take the time, then
if they want to use their
okay,
sick leave.
and otherwise, they'll just.
If we find something,
Maybe they have some ideas of things that they've seen that's like, oh, this has been just irking me, I'd love to get this done during, and I mean, if it costs us a little money to complete projects, but for the betterment of our district, it seems.
I would think paint would be pretty cheap.
that would just be a
Money for paint,
general.
Bradley?
What's that?
Do we have money for paint?
We can afford paint.
Okay.
Yeah, I would, well, we're saving money on gas.
Yeah, save it on fuel, spend it on paint. That's okay.
Yep,
Thank
okay.
you.
Well, I appreciate your input. I don't know if we need a motion for this, but
We'll just do one. Is there a motion to approve the distance learning from December 7th through January 15th? Sherry, is there a second? All those in favor? Opposed? Item 5, adjournment.
I'll make a motion.
Carl? Sherry, all those in favor? Aye. Aye. Opposed? 6:36.